You know, in depression, one of the main features is that you lose the drive to do things. And in neurology, we have a name for losing this motivation. And we call this term apathy. So it's a term that we've all heard before. We know what apathy is, but it has a specific meaning in the medical circle. And apathy in Alzheimer's disease is an extremely common behavioral consequence of the disease. And there's actually a center in the brain that tends to drive this motivation. And this motivation center degenerates as well as the memory areas. And so people with Alzheimer's, they may develop this situation where they just don't get out of the chair to do stuff. They're very apathetic. Do you want to do this? Yeah, okay. And then, well, are we going? Yeah, we're going. But they never get up and do it. And sometimes we'll try to treat that with antidepressants. Sometimes it's hard to tell apathy with depression from apathy without depression, but if there's any depression there, we do want to treat that because you don't want to suffer from a depression. But there are ways around this too. For example, if you've agreed that you're going to go out to dinner and the spouse with Alzheimer's disease is just not getting out of the chair, maybe it's time to go up and pull them by the hand and say, okay, let's go. And then once you get them up and get them to the show or the dinner or whatever, they're fine and they have a good time. It's just being there. They need something to initiate the activity for them because they're too apathetic to initiate it themselves.
Can I touch on one more thing? So a lot of times people will come into our clinic and they're having some depressive symptoms and they're having some memory changes. And depression, as we've kind of alluded to, that depression can have very similar symptoms to Alzheimer's disease, memory loss, the apathy. But if we're truly dealing with depression and not a neurodegenerative disease such as Alzheimer's, depression can be treated well. It could be through medications, it could be through talk therapy, it could be through exercise, diet. There's good treatments for depression, okay? A lot of times treating the depression will solve the memory problems or the apathy, and it does get better. It takes time and work, but it does get better. And we see an improvement in memory and thinking. If the depression is due to a neurodegenerative disease, so a lot of times in early Alzheimer's disease, people are aware that they're having trouble with memory, and that makes them depressed. And so if that's going on, where the cause of the depression is the Alzheimer's disease, we need to treat both. We need to be treating the Alzheimer's disease and we need to be treating the depression. But a lot of times it takes more cognitive testing to really sort out, is this memory loss and this depression due to Alzheimer's disease or depression, and trying to solve that puzzle can be a little bit tricky at times.